So this lecture focuses on just a handful of the medications that are used to treat various problems with thyroid glands. Learning objectives are here, relatively short. Here's the drug list. And again, there's only a handful of drugs. So let's get into some thyroid physiology. So remember, T4 gets converted or activated into T3, and that's in the periphery. And then T3 is the one that's more biologically active, binds to its nuclear receptor, and causes changes in DNA, which again begets different proteins. And all the different proteins and enzymes and various biomolecules that it's responsible for have numerous physiologic consequences in growth, in CNS, metabolism, as well as cardiovascular. So obviously, in terms of normal physiology, the thyroid hormone cascade is extremely important. Okay, and so what we're going to do is we're going to look at problems with abnormal expression of the biologically active T4 levels of thyroid and T3 as well. So what are we looking at here? So essentially we're looking at two different disease states. One is hypothyroidism, or low thyroid. The other one is hyperthyroidism, or hyperthyroidism. So aside from the thyroid gland not working, the disease or the indication of, or the presentation of hypothyroidism can be caused by numerous drugs and are associated with various diseases or syndromes, all of which are listed here. Okay, and in contrast, hyperthyroidism, also known as thyroid toxosis, essentially is associated with something like Graves' disease, which is maybe like a goiter, subacute thyroiditis, usually a thyroid storm. There are some indications or some examples of a hyperthyroidism that's drug-induced. The classic example would be the antiarrhythmic amiodarone, which remember has an iodine atom in its chemical structure. And of course, thyroid cancers are relatively common portrayal of hyperthyroidism. Okay, so we can't talk about thyroid treatment medications without bringing up Synthroid. Synthroid, which is essentially levothyroxine or recombinant synthetic T4, also known as tetroiodothyronine. Mechanistically, this is going to be the drug that gets converted into T3. And then it's going to activate the nuclear receptors, and that's going to alter gene expression, as well as change RNA, and then at the end of the day, to produce protein synthesis. T4 is really not as potent as liothyronine, or T3, but this is a much more useful drug because it's got a much longer half-life. This drug sits around for on average 7 to 10 days. And it's really the standard of care for hypothyroidism. Okay, this drug is orally administered, which is great. Patients are urged to take this drug on an empty stomach because food, calcium, fat, all those things can alter the absorption. And also, this drug should be taken at the same time every day. Because there are differences in terms of absorption from morning, afternoon, and evening. Really, the best time to take this drug is as soon as the patient wakes up in the morning on an empty stomach, and that's really what it's written on the bottle as well. You don't really see any physiologic effects for anywhere from 6 to 8 weeks after therapy is initiated. And then just to tell you how common this drug is. It's one of the top 5, probably maybe even the top 3 most prescribed drugs in the United States, and if not the world. And it does have a narrow therapeutic index. It doesn't mean it's particularly unsafe, but you need to really closely monitor the patients initially when they're first given Synthroid, because you want to make sure that they're within that therapeutic range in terms of their T4 levels. And just by way of comparison, we're administering very small amounts of this drug. It's we're giving micrograms, as opposed to all the other drugs that we've been talking about, which were in essentially milligrams. Okay. Along that same line, we can give liothyronine or T3, also known as triiodothyronine. Mechanistically, it's the same as the previous drug. This is much more potent, but it's less useful because it's got a short half-life. And so it's the same indication, hypothyroidism. We can specifically formulate this drug as an injection for myxedema type comas. Armour thyroid has an interesting history. This is a natural preparation derived from pork thyroid glands. And I worked in retail pharmacy for a few years. This has a really strong characteristic odor. As soon as you open the bottle, you know that you're dealing with Armour thyroid. And it's a combination of T4 and T3, which are listed there. We dose this in grains, not grams. But there is some variability from tablet to tablet because there's some variability in the amount of thyroid gland in these pigs. Think, maybe different strains, different rearing conditions, and so forth that can alter the amount of thyroid that's in the gland. These drugs are orally administered. They're not as common as they once were. Most patients, for a variety of reasons, would much rather prefer to take Synthroid than the Armour thyroid. This one's been around for a long time, and it's got an interesting story. So Armour Company is a meatpacking plant here in the south side of Chicago, and it's the original source of where these thyroid glands were made, the Armour, Swift and Armour meatpacking company. So there's a picture of the meatpacking plant, and of course, if you pay attention to your surroundings, you are sitting in the Armour Academic Center. And yes, the Armour family gave Rush, a long time ago, a large amount of money to build the Armour Academic Center. They were really big in philanthropy in Chicago and the Midwest. They also co-founded it used to be called the Armour Institute of Technology, now it's called the Illinois Institute of Technology, or IIT. You can see this building, this big red brick building right off the expressway on the Dan Ryan. So the Armour Company, pretty cool story within Chicago. And by the time, since we're on the topic of Chicago and the medical center, we should bring out the story of Upton Sinclair, who wrote The Jungle. So this book actually is about the meatpacking industry here in Chicago in the 1920s, if I remember correctly. And I read the book, and it was interesting because I lived at the Medical District City Apartments, which, if any of you are familiar with this is the apartment complex on Ashland and Polk Street, just a few blocks from Rush. The address here is 903 and 905 South Ashland Avenue. The book actually makes reference to a very popular destination at 905 South Ashland Avenue, which is across the street. This is the current UIC building. I think this is the Department of Molecular Genetics and Biochemistry. Before this building was built, which is kitty corner from the old synagogue and the current Greek church, this particular 905 location was the home of a house of ill repute for quote-unquote working girls in the south side of Chicago and the Loop, and many of the patrons were meatpacking workers from the Armour Meatpacking Company. So it was a pretty interesting story. I remember reading this book when I was actually in graduate school at Rush, and they mentioned the address, and I said, wait, that's my address. So I thought that was kind of cool. So pretty cool story about that. Anyway, let's get back to thyroid glands. And so the drugs that we were talking about were essentially thyroid replacement therapy, all indicated for hypothyroidism. Now let's switch gears and talk about hyperthyroidism.